Is my screen visible to you?
Yes, ma'am. You can increase the volume, ma'am. Seerat Gill, ma'am. Yeah.
Yes. Now we'll be beginning with the session. So before that, we are honored to welcome Dr. Rupam Sarkar, Assistant Professor and Academic Coordinator at DSGPI Maharashtra, as our distinguished guest speaker for today's webinar. Dr. Sarkar is the founder and director of Physiotrans Academy, Physio Research Hub, and has served as an item writer and reviewer for the Higher Education CET cell, Government of Maharashtra. He is also a former physiotherapist for the Indian wheelchair cricket team with 36 patents, 17 granted, over 23 plus copyrights, and 12 plus publications in Scopus and Web of Science journals. Dr. Sarkar has made remarkable contributions to physiotherapy innovation. He has been recognized with numerous prestigious awards, including the IAP Student Excellency Award, Best Student Award, and Youth Speaker Award twice, Master Blaster of Physio Award, and multiple accolades for excellence in physiotherapy and healthcare. He is an invited resource person for FES, CPR, and spirometry workshops, a reviewer for reputed journals, and currently serves as an assistant editor for JHPO Research. We are privileged to have him with us today. Before I hand this session over to Dr. Rupam, I would like to briefly highlight how artificial intelligence is contributing to rehabilitation today. AI is transforming physiotherapy by enhancing accuracy, personalization, and efficiency in rehabilitation. From movement analysis and adaptive exercise programs to data driven clinical decisions and improved patient engagement, AI is enabling smarter, outcome focused care. With this, over to you, sir, to enlighten us further.
Thank you, ma'am. Am I audible to all?
Yes, sir.
Yes, correct. So very good evening, one and all present over here. Heartfelt thank to IAP Women's Health Jalandhar District Team, Dr. Manika ma'am, Vaishali ma'am, and Sirat Korgil ma'am, for inviting me in this exuberant platform to share some knowledge with you all and physio community and also medical faculty as well. So, as already you have been brief about the what the topic today we are going to about, right? So today's topic is AI in physiotherapy, right? So within a few moments, I am going to share my screen. So just to brief about the what is actually the AI and how AI helps to improve our day-to-day life as well as the patient recovery as well. No doubt, increasing work demand and increasing patient population. Nowadays, patient focusing mainly on the physiotherapy part rather than consuming medicine or surgeries unless it is required severely, right? So the future is what? The physiotherapy is future, physio rehab is future, AI and innovation is future. And yes, no doubt the research part is also there that I will also tell within this webinar as well. So I'm sharing my screen. Is my screen is visible to all?
Yes, so it's visible.
Okay, yes. So, firstly, just we will go around what is actually artificial intelligence is. So, the artificial intelligence mostly refers the computer system performing tasks and typically require human intelligence. So,
Dr. Rupam, sir, you can go into slideshow. I think we can see like 2 to 3 slides. Yeah, yeah.
okay,
Yes, sir.
now
Done,
it's
done.
Yes, it's better, sir.
okay. So what usually the AI represent that artificial intelligence refer to computer system performing tasks and typically require human intelligence. And what we mean actually by human intelligence. So human intelligence the thing you should remember कि मैं हमेशा यही कहता हूँ कि इंसान ने कंप्यूटर को बनाया ना कि कंप्यूटर ने इंसान को. इट इज अ लाइक अ गुड डायलॉग फ्रॉम द मूवी बैक एंड. सो अगर if we depend everything on AI, it's not just the good because only human can control, human can give the randomized trial, then only we can switch to AI, right? Because the data stored in the AI will be helped to decide the whether his patient can be do certain type of exercise or certain type of activities depending on his or her criteria. Like, so why it is need for artificial intelligence in physiotherapy? And within past decades, it's not been there. And recently, it's AI is becoming an emerging part. Whether it's AI in orthopedics, whether AI in neurology, where AI in cardiovascular as well, and many devices and also many system been also been developed by our team and also many of our physio faculties as well in contribution to AI. Right. So the need of this AI in future is increasing patient load and demand. As I told earlier, the data collection and analysis that is also can be done by AI, bridging and also bridging the gap between the home-based and clinic-based therapy. Because many places we know that certain type of instrument or certain the doctor facilities can may not be available. So by the means of AI, that things gap can be bridged, right? So now the what can be application of AI? Application of AI covers the every part from A to Z. Okay, so if I take on a quick note that you might have seen the movie The Three Idiots at the in Three Idiots movie at the end you seen that the how Kareena Kapoor made delivery with the help of the telecalling, right? So uh, like that only. So by this that it can help to automated diagnosis and assessment of musculoskeletal condition, movement and posture analysis using computer, personalized rehab plan. They can make a rehab plan if you feed data on the AI or the system according to height, weight, BMI, the AI can generate. Okay, then remote monitoring and wearable sensor is already available, whether in a form of watch, whether in a form of rings and various things. So first we'll go around the how AI in movement posture analysis uses. Uh, so it can be helped in various cases. You can see there is a it is an app called that the AI Movo app. So this app is connected via internet, and whether a doctor or a physiotherapist can determine the flexion, extension, and ROM easily by the help of this app. So it can be used for neurological case also, get training as well, uh, any ortho rehab as well. So if you think like this app which can easily measure, so there is a device based on the AI is called the uh, mind motion. It is also based on the AI. So you can see the PC screen is there. and there is a camera below the hand. It's called the lip motion camera. So if you see both the screen and camera, it can detect the hand movement, and then it will measure how much degree it is bending. You can see in the screen. So totally it is a sensor based one. And first we are draw activity for ortho person for the gripping rehab. Suppose for example, so machine measures the angle degree, how much extent he or she can do. Now it will generate a game. It will generate a game so that the patient can do interactively, and also can rehab is also can be done. You can see if he release the hand, the block will fall down. So like this, the AI helps patient part and also interesting part. So this is the setup of the Go. It's called a mind motion or mindless. So the training we received from the faculty from Switzerland, they came and trained us in this. So the first step, so this type of thing you can see in the AI. So we need to do setup for that platform. It is not like that if you put a PC and do anything. So proper setup is also, because patient mindset, we need to understand what he want, what she want. Is the patient feeling boring or not? So depending on we can do. Okay. So this is a one example. Another example we can see that how AI can help in exercise prescription. Okay. So the exercise prescription is very precise part. We have to know it is not that only age, height, weight, and BMI is only by adjusting this only we can prescribe exercise, right? So one thing you can know that artificial AI does not have any empathy. So the empathy part only human beings or doctors, physios have. So this thing we need to look after. For that, we first need to do the every disease CTRI, that is clinical trial registry India. So wherever any apps or any machine develops, we take the trials, and in market language it is called as beta testing. So without beta testing we can't launch that app. So few things, a few apps and software are being prepared, and many devices are being patented by our team as well. So the adaptive algorithm modified exercise intensity based on performance, how patient perform based on that exercise they does. Virtual AI coaches are also there, which provide real-time feedback and motivation, facilitates individual rehab program. Suppose if you can see that in this app, that is a Rehab Novo app, which has been currently under process. So for example, think that is the case of the low back pain. That lady is doing low back pain exercise and strengthening her core muscle. So the repetition is counted by the machine. Also, the angle is counted by machine. So in the setup, if you set a speaker and a mobile phone in front of you, so the machine can count everything. So by this can be a guided for the mm, future upcoming orthopedic disease, and very well they can guide. But yes, we need to make awareness. That awareness is important part in the Indian society. That also the how to use and use to the technology. Okay, there is a scale is there, the technology assessment scale. How the patient and how elderly population are interacting with technology. That is the important thing we need to make aware in the India. So similarly, there is a many wearable devices and remote monitoring are also there. So how it helps the AI with the wearable IoT, Internet of Thing devices, sensor motion, heart rate, EMG, balance metrics. So these all has came under in our hand also. Like if many, for example, many watches that I watches are there, Apple watches are there, many watches are there who they can really they can measure the heart rate, and if they go on high, so it can detect the emergency contacts as well. So these are the short example, and now everything right from the head to toe, everything can be, we can convert the each machine into AI, and so the collective information can be stored in a data, personalized data, and that can be used for the treatment purpose. These are a few example. If you see the smart ring finger rings are also now become smart glasses already is there. The smart watch. Now, if I'm not wrong, in the future also smart pants, shoes, and a smart t-shirt also there. So and these are also being thing been done already. Apart from pant and shirt, the rest of the thing are we have already developed and patented as well. Uh, so this can be done like for example a smart shirt, it can be used to measure. We can put EMG sensors on that shirt, or or we can measure a sport performance of any athletes with the help. So we can do such activities. Smart shocks can be there, like to prevent the DVT, dip and thrombosis. This can be done. Okay, and yes, for this, it can be we require some fund, and then we do beta testing. Then after we can release in the market. Okay. And next, how can AI in pain and functional and assessment? It plays an important role. So no doubt AI models analyze facial expression, voice, and motion for pain detection, because we have an app is called the TalkPath Therapy app. The patient who have dysphagia, the after a stroke, or the patient who have been tracheostomy for a few months or a 1 month, they forget how to talk, or in a stroke also they forget how to swallow. So for that also the app is there. And so okay, so some clinical example we can see that the AI based motion analysis improved post stroke get rehab outcomes. Okay, so machine give feedback how he or she is walking, and also it enhance virtual rehabilitation system and how improve the adherence that as well. So if you see, so so you can see in this video there is a Sairabo hand gloves. It is also functionable, but it's not like a normal Sairabo because it is connected to a monitor, uh, where like the gloves I am wearing is called the master gloves, and this is and what I will do that gloves will also do and perform uh, the successful movement of the patients, motor function, quick motor function, neuroplasticity can be developed by the use of this app. So these are the things we can do by the use of AI. And recently we have been encountered with a new device that I have been trained, that is people came from the Malaysia, that is Symphony Synergistic Physio Neuro Platform. So it tells that brain and muscle as a whole. So what you will think the our hand and what you will think our hand and body will act like that. So there is a two equipment in this part. One we put in the patient's head and another we put in patient hand. So mostly it is for the patient hand recovery function, because you know that after a stroke or TBI, anything the hand recovery and finger movement, fine movement came so delayed. So for that purpose, mostly this been developed. So it is simple. It is called the Symphony Synergistic Physio Neuro Platform. So it is both the machines are connected, the hand part and the brain part. So what you will think the machine is also do, and based on that, the machine will develop a game for you. So whether you can do functional activities like eating, like cooking, like holding an object, gripping an object, releasing an object, like that. So by that background and researches, we have developed a few devices as well. So so you can see the one of the devices called the AI Balanced Rehabilitation Tool. So this is already been granted by the GOI. So this the patient will stand in the base of this platform, and the balance then the screen is there. That will machine will sense in which direction the patient is going to sway and which direction patient is going to fall. So the feedback they will get. And also these two sticks are there, so that it will be like patient can hold if he or she is getting fell down. So like this one machine is there, and another is uh, is in the cardiovascular rehabilitation, that is the AI assisted breathing rehabilitation system. Okay? One, we have already know that the spirometer is also there, and that we give a traditional spirometer that we give in patient in ICU, right? So this is the machine. You can see the green part is there. This green part is a sensor of the machine. So the how much flow we are giving. So each time the machine is sensing, and the app is being connected via. So it will count how much and how much flow you required. So they can give a feedback. So per day, how many times you did, right? Right from the traditional spirometer, we patient ask the patient to pick up the balls, and we need to count or anything. So the patient can be give targeted via connected to this machine, and if effectively they can do. Another machine, the it is also called the for traumatic brain injury. The machine has been done. The head. This is also a head part. We can place the machine in the patient's head, and this is a back. This model can be modified because as per innovation. and the patent objection. So we decide this type of model, but in reality, it might be some different thing. But the background and innovation part and what is the concept will remain same. So the what will machine will do? It is purely based on AI because TBI patient haven't a motor control, right? So it does the cortical stimulation. So there is a electrode, positive and negative electrode is there in this part, and this is the battery part, and also the data storage part will be taken by the patient's back, and by this the stimulation will be done in patient brain, and it may help to generate the neurons and neuro excitability, so the patient can recover quickly. Similarly, this is another device. It is a AI based uh, orthosis. Okay, so like you have seen that the robotics which helps, that is a locomat, the patient help to walk. So for upper limb we have very less things, so we developed these things that it is also connected via app, and the patient's flexion extension, even the finger flexion extension single we can do via these machines. So, and this is the recent thing. It is we have give the machine name is the Sahyok robot, and also this is already I already presented in IIT Bombay and in collab with Maharashtra University of Health Science, because this abstract was selected because I feel that elderly person who are in an agile age, because the older person what they need mostly the time to time medication and some guidance, and someone who is available for 24 into 7, right? So you can see this Sayhok robot has been designed by us, and there's a camera in front, there's a tablet and gripper for hold sometimes sorts of object, arms and base. So this is a smart robotic support for elderly population who have cognitive and mobility impairments, right? So so suppose, for example, the in the room you can keep, and the camera is should be already 24 into 7 in on mode. So the machine is sensing how the older person is behaving, what expression he or she have. So by the sensing, the machine sends data to his or her family, and they can get aware. Even though it can sense the oxygen level as well by the means of infrared. Okay, so and this is the another device in the community-based rehabilitation. So it is a sensor-based stick. So patient it can detect if the patient having some visual impairment, or patient is very agile, he or she can use that this type of stick, and the stick will senses the ground base where it can get the base of support, where there is a hole or not in the road. So the machine will give feedback to them. So these are the first function of AI. And again, this is like for the Parkinson patients, the AI integrated auditory and visual cueing apparatus. So it is also being filed. So the most important part in the uh, Parkinson patients are like they are unable to do easily movement, okay, and the vibration is also there in the hand. So for that reason this machine will control this type of unextended tremors, right? So and this will help to patient maintain the control of the body, and also the easy the gait walking pattern as well. And the this is we have filed this patent in the utility patent, also published in the IPR journal. So this is a system for critical care cardiac physiotherapy using a smart ventilation, right? So in normal case, we need nurses and doctor 24 into 7, right? So we create a system where we can get A to Z things, like from the oxygen marks, from the worker, and from everything. It will be connected to a sensing system, whether it is a smart ventilation controller, it will have a sensor suit, it will also have the clinician interface and the therapy planning engine. So like for example, if you went to any uh, replacement, like a lung replacement, kidney replacement case, there this type of machine can be incorporated in that type of setup only, because no doubt this will take some extra charges, but the usefulness of this, because you require not to present all time with the patient, because everything will be sensed by the patient, and directly it will connect it to the nursing station, the patient, how many flow rate it is going on, how many oxygen they are taking. Even the muscle activation part also senses by the system. So it is mostly for the cardiac patient or the patient who have a long-term planning in ICU support. Okay. So this is a sample, this official journal. We have patented the devices in utility patent and explain the function, how it will be work in futures. So the advantage of the AI that enhance precision and data accuracy, continuous real-time feedback during rehabilitation, and cost-effective scalable solution for remote physiotherapy. And yes, the main important thing with the AI, what I feel that we need to do selection criteria of the patient should be important. It's not like that the it or not it is a machine. So uh, if any patient you put in the any machine at any time, it is not like that. You need to check the selection criteria of the patient. Accordingly, we can decide the things, right? So yes, there is some limitation as well. Every which thing who have advantages that have also disadvantage, right? So there is a data privacy and patient consent challenges. So this thing to be collaborated by the government of India, Ministry of Health, so how they should protect the data, and the interface should be only in hand of the clinician doctors only, so that patient can delete the data. Because if they delete the data, we can get the proper data for the planning or future planning of his or her access protocol like that. And algorithm based reliability concern need for clinician oversight and human judgment. There's no doubt, as I all earlier told, that the human only have empathy, machine doesn't have. So these are the things we may face. Okay, so no, undoubtedly, future scope and innovation part is very wide. Expect in case of the research, in case of publication. So the more research and publication patent you do, the more it will get the credibility that yes, it will work, because government doesn't approve the patent and innovations in the close eyes, right? So you need to do in the future and now time as well. So AI driven robotic physiotherapy, exoskeleton, predictive analytics for recovery outcomes, integration with virtual and augmented reality for the immersive rehabilitation. And also nowadays the tele rehabilitation is also like a getting boon for our uh, mankind. So the future is AI. And in conclusion, all I can tell that AI is transforming physiotherapy by enhancing the double PA, that is precision, personalization, and accessibility. The future lies in the hybrid human, and we can ensure that it's our responsibility to ensure safe, ethical, and evidence-based care for this. So thank you. That's all. Any Q&A are most welcome.
Now we'll be taking up the question and answer session. If anyone has any questions or doubts, please feel free to ask.
Ma'am, I think there is a question in the chat box. Will AI tools result in improved data analysis and insight?
Yes, but for first, we need to check the data analysis for which purpose. It is for academic purpose or it is for clinician or what purpose? Because if we taking, for example, two type of data, one is academic data and one is a clinician interface data. Academic data, like if anybody is thinking that they should complete his or her research work by putting data in AI, so it will not be beneficial in future as well, no doubt. So if they are taking for the uh, data for the any patient improvement or anything related to the machinery, yes, that will be helpful. But yes, for data part, I think we should have to be done by the SPSS software only for better outcome, because even AI not give sometime right data.
So there's another question
Yes.
by Divyanshi Nazare. Cost effectiveness of these devices.
See, it varies. Some device may cost around, it is cost effective, but some device it may cost many lakhs. Because, for example, the device which I have presented in IIT Bombay, that cost around 60 lakhs. So in Indian setups, we can't expect you keep one machine 60 lakhs and another person who can look after him with a sponsor, and also the India, right? To put our devices are need to learn the all the things. If you get any opportunity in such clinics, it will be good for students' futures as well, because the future is AI.
So there's another question by Jatinder Gupta, that AI will be more helpful in neuro cases than all other cases.
See, AI is like that. Mm, I can tell that AI can be beneficial in all the cases because the person or selection criteria of the person is important thing. AI can also helpful in cardio cases as well. And yes, it is not right that you are using AI in the critical patient, right? For critical patient, we can only use the gold standard test, like for example, 6 minute walk test, right? So if a person is in a critically ill patient, you can't put it in a AI mode. So for that case, the in-person visits are very important. Because for example, even I have a case in Maharashtra only in a remote area where the many doctors or physios are not available. So they are putting they are having a nodal center for digital health team so that they can guide because doctor can reach machine can't reach. So it is very like the remote areas, so there is a digital nodal center is there in the Maharashtra only. So they are guiding the patient because if you take for example of heart case, right? So nowadays the heart attack is like it can occur in any time. So we have the client that we take the real report like cholesterol report, ABG report, or you can tell that ECG report, because AI can't do this thing alone. So by combining the blending the uh, gold standard test and AI, we can get better output. So you need to select the which criteria patient you want to take.
So there's another question by Dr. Vishali and Dr. Saxena, that will AI replace healthcare jobs or augment them to focus more on patient care?
It is all depends on adherence, right? Because the factor is that AI will not take human jobs at all because in first only I have told that we have created the machines, not machine created us. So the thing should be in our control because when see the how the machine will get validate. It's not like that you launch in the market and it will every people will start using. To be honest, you do the research with that machine, you do that all data analysis pre and post treatment, you take all the videos how AI is really helping or not. So for that the behind, who is the behind, the man is in the behind. So you can train the many other men like that for giving same time of training. So it is not like the AI will replace. However, AI can increase the job, what I feel, because if one machine is invented in AI, then several machine can be also invented by the use of human beings only. So the loop is like a human is the creator, the human is a destroyer. So AI can replace the human machine, rather than we should have control and not fully reliable on the AI because it can't be done totally.
Very well, sir. So there's another question by Prarthana. Um, they are asking, sir, for remote areas, sometimes there will be network issues. So during those situations, is there any way to ease the problem?
Yes, that's the matter. There's the few places in our locality that the network is the big issue, and also the technology part is also not everybody take up. Like old person and many other who have the conservative thinking. Even in a few of my friends, dads and moms are not using that smartphone, and that's fine. For that, what we can do that government should take initiative to make a digital nodal center because uh, I am assistant professor in Maharashtra University of Health Science. So there, like we have a course, Digital Health Foundation course for each and every staff compulsory to be done, right? So these are the things that government should take initiative so that they can pass on the message to their family or to their colleagues, and this should be incorporated right from the education and competency based model so that student can get learn and they can pass on. So by this legacy only we can develop full technological support with guidance and data encryption.
So another question by Saxena Manika, that what resources are needed for successful adoption?
Resources that adoption is the you can get used to the technology as soon as possible. That's what I can say. Because for adaptation, uh, technology knowledge is important thing. So even we uh, any machine we take a trial on the patient, we take a scale, robotic assessment questionnaires are there, technology assessment questionnaires are there. So there is a checklist. You need to check the which person to take. No doubt when we test any machine, we try to take up such person in population who are used to the technology. Okay, so this can be the barrier, but it is not a major thing, because if we develop some good high apps which can checks the human beings right from A to Z, so this problem may be solved, but not now. It can't be solved because in India lack of awareness is the main hindrance between these two, technology and adaptations.
So another question is from Dr. Harshita. How can AI help cardiopulmonary patients?
Cardiopulmonary patient in AI is a very good thing, because in Maharashtra, Mumbai, only one of my colleague have the first tele rehab clinic in, I think, India, Navi Mumbai. It is present. So she does a very good job. So in like every patient, she doesn't even take in person or home visit. Only tele rehabilitation in AI. Everything is done by the video conferencing, video call, because she also deal with the international clients as well. So these things we can do by the help of telerehabilitation, and cardio is most important factor. And I think cardio is on a top in the telerehab part. It can be done swiftly, but yes, as I told, some gold standard tests are there, like 6-minute walk test, blood cholesterol report, or pulmonary function test report. This should be sent to the his or her physio in every 1 or 2 months to take the a good result and good outcomes of the patient, which should be blend with it should be mixed with AI and the doctor's advice, so to take good outcomes. So it is helpful in cardio case.
Rahul Kumar asks, Sir, we should completely depend on the machine. Sometimes machine gives wrong result, then how it will be improved? What techniques should be applied in this case to improve it?
Yes, definitely. It should include, for example, if you are watching any watch also, if you move the watch like several times, it will count your steps. So these are the also things we can modify it time to time. But as usual, it will not solve too quickly, because apart from this, many other things also there for the for make focusing, as it is also software based, so it can shut down. So we need to have backup. So yes, for research and accuracy purpose, we need to keep trial on the machine for many patients. Like first you do the pilot testing in one, then you take a few population, then you take the region, then you take the whole country. But for this, there is a like backend team which should make a research and analysis, and also you can get fund from the ICMR management as well. So these are the things you can do, but the research, without research, it can't be possible, right?
Basim asks, what measures are to be done to make such rehabilitation programs affordable?
As I told, for this program affordable, first of all, awareness right from the student who are entering in the Bachelor of Physiotherapy course. There should be in syllabus only, it should be get included a digital foundation course and AI machine learning. Even few 1 or 2 months earlier, I go to a school, good private school of the CBSE board. They have from class first or nursery standard only, they have created a artificial intelligence and robotics lab. So I was very surprised to see that when I entered that room, the full of the AI, robotics, rockets, pictures, and models, real model are there. So if you create such environment, then student will definitely grip the thing and they will know the importance. And yes, the future is the students only. So if they grip the things, they will pass on to their elders or pass on to their friends, and that's how we can change the scenario in the mankind.
There's another question by Anant Trivedi. He asks, Sir, there is any AI app for any instrument to assess the sports person, as you showed example of neurology case given sports field as well.
Yes, so there's an app which is under developed by our team only. It is a Rehab de Novo app which I showed in the slides. So this app is being under process, and within a few months we will release in the Google Play Store as well for the purpose. And for that also, apart from app, we have some small devices which will be like a patch, which will put patch on the skin, human skins and muscle, and it will measure the skin is muscle is contracting or not. And there is also one patch in the terms. There's a machine which can be set it in the like electrode like that, display electrode. In the heart also we can put in the heart, which can measure his heart rate. We can put in the fingers, which will measure the that oxygen saturation level. And these three collective information will be gathered, which is connected by your app, that is the Rehab de Novo app. So definitely it will give a real time feedback for the athletes, and it is good for to use in the sports rehabilitation.
Another question by Dr. Vishali. She asked, who is accountable if an AI system provides an incorrect recommendation that leads to patient harm, the physiotherapist, the software developer, or the institution?
Yes, in that case, what you can do. So, most of the times I definitely I present in live only, because you need to monitor the things. Even you take the example of that Sayok robot, which has been developed by IIT Bombay. So there is a three-phase we conducted. First phase, just we have display the screen in front of the patient, and the patient is observing in the screen only the what machine is doing. Okay, first phase. Second phase, we have put the machine and patient in front, in both two in real case, and the patient is observing what patient machine is doing in front of him. And the third case, we have allowed it to interact the patient and machine both, like what the patient command machine does. And we have seen these things in from the another console, because we are not present in front of the uh, patient or that in that room. So the machine have a camera in front, and we can see the patient in front of them only. And we found that many elder patient have the frightened of the robots. So we can't conduct in such patient. Many elder patient means above 60 years age, can able to do. The thing is that we should take the selection criteria of the patient very wisely. So who can do, who cannot do, that's in our hand. And yes, in regular basis, we should do that calibration as well, time to time, to get more accurate result, and should take a gold standard test form, and it may vary disease to disease. For example, in a stroke, we can take a D dimer test, so that D dimer can detect the in the blood active clot is there. For acute cardiac arrest or any cardiac patient, we can take the creatine kinase test, so we can detect the whether any heart problem is going to not in not in futures as well. So these are the things we can check apart from believing in the AI or machinery's part.
Okay, another question from Dr. Harshita. Did they develop any app that can help the patient during tele rehab sessions?
Yes, the app, 3 or 4 good app is there. Uh, if you think, I will share in the group as well. So TeleRehab app is available in Google Play Store only. You can find it. Also, it will take the exercise counting as well. So I will send the links. You can go through the links as well.
Ira Agarwal asked, are there any economical approaches that can incorporate AI in clinical use?
Uh, Till now, many clinics have incorporated like that Mind Motion Go. It is also fully AI based. The few centers in Gujarat, Ahmedabad is also incorporated. Few center, 1 or 2 center in Pune, Mumbai is also incorporated. Yes, it requires fund, but more important than fund, what we are trying to do is make awareness in students. because if they are aware, they will try to do more research and more things. They can do better than me also, and us also as well. So it's not like that what we have developed, this is also final product. So, okay, so maybe the what you are asking today, that is there any what happened, the AI will make mistake, right? So in you can see in the 5 years later there is a they can't make any mistake, because we should take a every randomized control trial to the patients. The more research you do, the more accuracy you will get the data. So it is all how depend what patient you are using and how you are using.
That's also. Should we conclude the session? Okay.
Yes, ma'am. Yes, ma'am. Thank you.